What are the top 2 COPD symptoms that can tell you if you're a blue bloater or a pink puffer? Well, the answer is pretty simple. It's actually in the question. Let me explain. Key clinical features of blue bloaters: chronic cough. Patients experience a persistent, productive cough due to excess mucus production in the airways. The cough lasts at least 3 months per year for 2 consecutive years, meeting the definition of chronic bronchitis. Overweight and cyanotic appearance. Many patients with chronic bronchitis are overweight or obese, partially due to fluid retention from right-sided heart failure, cor pulmonale. Cyanosis, bluish skin, lips, and nail beds, occurs due to chronic hypoxia, low oxygen levels in the blood. Elevated hemoglobin, polycythemia, chronic low oxygen levels, hypoxia, trigger the kidneys to release erythropoietin, EPO, stimulating increased red blood cell production, secondary polycythemia. While this helps transport oxygen, it also thickens the blood, hyperviscosity, increasing the risk of blood clots, stroke, and pulmonary hypertension. Peripheral edema. Chronic hypoxia leads to pulmonary vasoconstriction, increasing pressure in the pulmonary arteries. This causes right-sided heart failure, cor pulmonale, leading to fluid retention, swelling, edema, in the legs, feet, and abdomen. Other signs include jugular vein distension, JVD, and hepatomegaly, enlarged liver. Rattling noises present while breathing. Excess mucus and airway inflammation cause coarse crackles, rales, and wheezing, which are audible during auscultation. These rattling noises indicate airway obstruction and secretion buildup, requiring interventions such as bronchodilators, corticosteroids, and chest physiotherapy. Wheezing. Airway narrowing due to mucus accumulation, bronchospasm, and inflammation leads to wheezing sounds during breathing. Wheezing is especially noticeable during exhalation and may worsen with infections or exacerbations. Pink puffer, emphysema, labored breathing, dyspnea. Patients with emphysema experience labored breathing due to the loss of lung elasticity and air trapping. The destruction of alveolar walls causes difficulty in exhaling trapped air, leading to increased respiratory effort. To compensate, patients breathe faster, tachypnea, and often use pursed lip breathing to prevent airway collapse. Older and very thin, cachexia. Emphysema is more common in older individuals, as long-term smoking or environmental exposure contributes to lung damage over time. Additionally, increased work of breathing, WOB, results in high-calorie expenditure. Due to malnutrition and muscle wasting, these patients appear frail, with significant weight loss. Barrel chest. A barrel chest develops due to chronic lung hyperinflation, which increases the anteroposterior AP diameter of the chest. The destruction of elastic fibers in the lungs prevents recoil, trapping air inside the alveoli. Over time, the ribcage expands outward, and the diaphragm flattens, making breathing even more difficult. Shortness of breath, dyspnea. Emphysema leads to progressive shortness of breath, as alveolar destruction reduces the surface area for gas exchange. As a result, patients experience chronic hypoxia, low oxygen levels, and air hunger, requiring rapid, shallow breathing to compensate. Use of accessory muscles to breathe. The blue bloater phenotype, chronic bronchitis, is characterized by airway mucus production, cyanosis, right-sided heart failure, and peripheral edema. These patients struggle with poor ventilation, leading to CO2 retention and increased hemoglobin levels. In contrast, the pink puffer phenotype, emphysema, involves alveolar destruction, severe dyspnea, barrel chest formation, and muscle wasting. These patients compensate by hyperventilating but experience progressive respiratory failure over time. Both COPD phenotypes require bronchodilator therapy, oxygen supplementation, infection prevention, and pulmonary rehabilitation to improve quality of life. Well, thanks for watching. If you found this video helpful, please like and share it with your friends. And if you haven't already, please subscribe.